Adam Sos here for Rebel News. I am very happy to be joined by Dr. Rob Roth, the president of the College of Naturopathic Doctors of Alberta. I want to talk to you about a number of things. Particularly, you had a meeting quite recently with the health minister, Adriana Lagrange. But I also want to sort of tackle some issues and some misconceptions about sort of naturopathic practices head on. It's interesting, not all that long ago, it would seem that progressives or folks on the left, probably in fact just right before the COVID pandemic, they were the ones sort of advocating for holistic healthcare and sort of natural alternatives. Now it seems definitely you'll see some more conservative minded people sort of embracing that. But setting the policies and politics aside for just a moment, are you a real doctor if you're a naturopathic doctor?
Yes, naturopathic doctors are real doctors. You need a minimum of 7 years post-secondary education. Ostensibly, you need an undergraduate degree plus another 4 years at a accredited institution. There's 2 of which in Canada, and then about 6 in the States. And so you can actually get in some of these institutions with 3 years in your undergrad and then 4 years. So the minimum being 7 years. But they're 4,100 hours of training on average. All of them have outpatient clinics that we end up doing clinical rounds in, and then you can actually do optional residency programs after in different specialties. But to answer your question, yes, it's a rigorous training.
And I suppose then there can be, whether it's naturopaths, conventional doctors, psychiatrists, whatever it may be, there are good and bad practitioners of every type of care. Do you have any sort of recommendations or advice for folks out there if they are interested in naturopathy, how to find someone they know they can trust, someone that's credible, reliable?
Yeah, absolutely. That's a great question. I mean, it's important to remember that yes, like naturopathic doctors are a regulated health profession here in Alberta and many other jurisdictions in Canada and North America. And so the first thing is that every naturopathic doctor needs to meet a set of standards, that you have to clear for the basic minimum amount that you need to be able to perform in your profession, essentially. And so, you can be assured of that. And so you could go to the College of Naturopathic Doctors of Alberta, their website, and they'll have a list of NDs in the province, or nationally, we have the Canadian Association of Naturopathic Doctors that indexes all these doctors, and then doing a little bit of, background work with regards to going through what their history is and what their pedigree is, what they might what they might specialize in, so to speak, in terms of that. Most people are familiar with doing little interviews with regards to their family doctors to see if it's the right fit. It's critically important for patients that they are gelling well with their care practitioners. And so going in and just, interviewing and pressing the naturopathic doctor and asking them tough questions. If you have doubts, like go in and ask them. Oftentimes naturopathic doctors will do free consultations for patients if they want to do a meet and greet with them to basically understand, well, what is the competency or the aptitude of this individual?
So I suppose the other question for you then, and I mean, you can't obviously speak on behalf of all naturopaths, but there might be an understanding that you exclusively are dealing with like vitamins and then this, that, and the other thing. Is there times where chemical medicine, big pharma medicine is the solution? Or I mean, there may be a sort of idea out there that naturopaths are just categorically against that. Is that the case?
Not at all. Not at all. We are not categorically against that at all. And I think it would be irresponsible to even definitely, it'd be irresponsible to even kind of broach into that, because it's just not factually correct. And ultimately, of course, there's lots of scenarios where we need pharmacological interventions. We need all of these standard of cares involved in our healthcare. And if you look at other jurisdictions like British Columbia, where these naturopathic doctors have Schedule I prescribing rights, they're able to order and apply certain diagnostic imaging. Naturopathic doctor isn't antithetical, I think, at all to the use of pharmaceuticals. Right. What we're probably trying to advocate for is that, having a robust toolkit is helpful. So if you come in and you want to prevent cardiovascular disease, the standard of care is likely, in your family, if you go and see your family doctor, is likely to get prescribed a statin drug to lower your cholesterol. And naturopathic doctors would say, well, listen, this is actually really potentially important, and we should have that discussion. And we should probably also talk about other things that we could do to assist with the risks of your cardiovascular disease.
Right.
Maybe what's the right dose and intensity of exercise? What should we be doing for, possibly some supplementation to your point, or other avenues. What can we do to mitigate the cardiovascular disease beyond just the pharmacological agents per se? But there's still a linchpin to people's health care. But it's also important to recognize that, pharmacology on its own isn't a monopoly on health. I think that's also, not an appropriate statement. Nobody, I think, believes that they get their health is tied into just having drugs and surgery. I think we all can recognize, like, healthy sleep, the right nutrition, our exercise, potentially supplementation might fit into this. As you'd said, like with mental health and so forth, or psychiatry you'd alluded to, but say clinical psychology, all of this coalesces and distills into what health is, and pharmaceuticals are part of that.
Clearly, the UCP, Minister Lagrange, says there needs to be some sort of change. There are issues in healthcare. Wait times are too long. There's doctor shortages. The NDP is also constantly talking about the lack of doctors. Now, there are quite a few naturopaths across this province, I would imagine. Do they have the capacity to sort of step up, meet the needs for those people? Can they be the primary care providers for people? Is that something that can happen, that can help alleviate and address those concerns?
Yeah, that's a great question. I mean, I think everybody, and as you said, the Ministry of Health here in Alberta is recognizing that there are deficiencies that need to be shored up. And then I think that they are taking a very innovative and bold and courageous approach to solving it. Personally, I think that there is space for multiple people kind of on this highway of healthcare, for medical doctors, for nurse practitioners, for the pharmacists, for naturopathic doctors to play a role. And to be direct to your question, yes, I think naturopathic doctors certainly can form a very important piece of the healthcare system. We have, approximately 300 naturopathic doctors that are registered as part of the College of Naturopathic Doctors of Alberta. And so, yes, there's a lot that we could do to take the pressure off in this and in primary care.
Well, this UCP government talks a lot about reducing red tape and sort of getting rid of bureaucracy. I mean, if someone comes in, they say their arm hurts, you feel it, you're like, I think this is broken. You send them to an x-ray versus having to send them back to a doctor. Testing, prescriptions, all these sorts of things. How much could this reduce sort of wait times? How much could this reduce the lack of access to care?
I think a lot. I work in an integrative clinic where I'm able to interact with medical doctors on a daily basis and collaborate in patient care. And I really can see very quickly, how patients can get bogged down, even when I try to refer for something like the labs or a pharmaceutical that the patient might need to be prescribed.
Right.
And so I think that, yes, like very significantly it can, exactly to your point. Somebody comes in and they've injured their shoulder and they might need an x-ray or ultrasound. Being able to order that diagnostic imaging for the patient to see if they've damaged their tendons and then what we should do about it. It saves money in the system. It is helpful to the patients. And we're not doing anything to take away from what's happening with the medical doctors. We're just here to help collaborate in a collaborative sense. And again, I think that's what the nurse practitioners can help to do, and the pharmacists and potentially naturopathic doctors, as well as the medical doctors. And I think that kind of innovative strategy that Adriana Lagrange and the Premier are initiating I think it's a very bold and courageous way of looking at healthcare. And at the end of the day, I think will filter down and facilitate everyday patients that are coming in to see their healthcare providers.
How refreshing is it to see a provincial government that is taking a drastically different approach?
Very refreshing. I think that you're hitting the nail on the head with a lot of this, which is that optionality matters. Like what I value shouldn't be what you value, and vice versa, and for the next person. And the result of that is that each individual is going to have a certain value system as to how they want to handle their healthcare and their own health, I should say. And for some patients, that's going to want to be seeing a naturopathic doctor, and for others, it's not going to be. And all of that is fine. I think that we need to kind of meet at a point where we can all contribute into the healthcare system. And so, to go back to your original question, having optionality in the healthcare system makes it stronger and more robust, so that we're able to provide the care that people want. Because there are patients, absolutely, that want to see a naturopathic doctor for their primary care, have them as the point person, and people who don't, people who want both to be collaborating. And I think that the healthcare system is stronger for that. I think our government recognizes that. And I think that a move away from that is, I think that that's just, I think it's dangerous to be too myopic with, just with what health is.
When you have multiple perspectives weighing in, sort of collaborating, meeting people's needs, people sort of getting what they want with something as personal healthcare, I think people will certainly benefit. Plus, when the outcomes are reduced costs, reduced wait times, increased access to doctors, I think it's an absolutely no-brainer. Dr. Rob Roth, I want to thank you so much for your time. Really appreciate it. And for everyone at home, I want to thank you so much for tuning in. For Rebel News, I'm Adam Sos. Hello everyone, I just wanted to take a moment to encourage you to consider subscribing to Rebel News Plus. When you do, you're supporting us in telling the other side of the story, but that's not all you're doing. You're also getting access to incredible content like our exclusive shows like Ezra Levant Show and The Gun Show with our own Ezra Levant, obviously, and Sheila Gunry. That content is available nowhere else. But beyond that, particularly if you liked this interview, you're getting access to our exclusive documentaries like our latest documentary, Unsilenced, Canada's Underground Medical Rebellion. Lots of the topics we discuss in this interview, well, they feature prominently in that documentary. So support independent news. Go and help us tell the other side of the story by subscribing at Rebel News Plus.